We've arrived at the digestive system part 2, and we're looking at the oral cavity and the teeth here. We're actually beginning on page 856. As you notice here, the tongue actually consumes a great deal of space within the oral cavity. Here is our passageway here, and we're going to be having a nasopharynx, an oropharynx, a laryngopharynx, and all of this participates. The soft palate right here lifts up during swallowing. The epiglottis closes downward and protects the passageway for air so that food travels only in the esophagus. Here is the oral cavity, and we're noticing here with the handy use here of retractors that we can see inside this little area right there. And so that's going to be called the oral vestibule. Anything that's between the gums and the teeth is referred to as the vestibule. And then we enter the passageway here. You can see that underneath the tongue we have little openings here for saliva underneath the tongue. Up here on the hard palate, and then out further on the soft palate, we have these arches. We have a palatoglossal arch and a palatopharyngeal arch right there, and these are all labeled for you on your diagram. We have the tonsils right in through here. These are the palatine tonsils. Okay, so I need you to know the nomenclature on this page here. You can take a look at all the nomenclature as it's illustrated here and labeled to go with the illustrations. So enjoy that aspect of it. Over here we have the tongue. The tongue has musculature moving in many directions, so the tongue has the potential of also moving in many directions to manipulate food as well as aspects of vocalization. So we have many options here with the tongue. They're talking here, though, mainly about the taste buds. The taste buds are not found on the filiform papillae. Those are free of taste buds, and they're just there for function. Whereas we have fungiform papillae, we have circumvallate papillae, we have these great big papillae back here. All of the area back here is often concerned with the flavors associated with bitterness. It could be the aspects of chocolate or coffee or quinine. A number of things taste bitter. And through here we have the anterior two-thirds of the tongue, which is going to be innervated by the facial nerve. The facial nerve is cranial nerve 7. Back here, the posterior one-third is the cranial nerve 9, glossopharyngeal. And then there's taste buds way far back on the tongue and also at the top of the mouth on the palate. Those are innervated by 10, the vagus nerve. Okay, so consider over here that we also have taste buds on these folate papillae that are fairly prominent in childhood, and they're retained for those who continue to enjoy sweet flavors through even adult life. Okay, so then also associated with the oral cavity are going to be the salivary glands. The salivary glands are going to be 3 in number. There's going to be the parotid gland here. The parotid gland, I want you to know, is innervated by the glossopharyngeal nerve, cranial nerve number 9, only by the glossopharyngeal nerve. No other salivary gland is innervated by the cranial nerve 9. Down here we have the submandibular and the sublingual glands. For some reason, I see they're referencing the duct here along with the gland. And then over here, they're referencing the sublingual gland. So the sublingual gland in substance is beneath the tongue here, down at the floor of the oral cavity, whereas down here you can actually palpate this, and it's commonly palpated if somebody has a sore throat. So this is the submandibular. The submandibular's duct actually passes through the sublingual and exits into the oral cavity through the openings for the sublingual gland. So these are glands innervated by cranial nerve 7, facial. This is a gland innervated by cranial nerve 9, glossopharyngeal. Notice over here we have a picture that shows mucus-forming cells as well as serous-forming cells. The red ones here are called serous demilunes because they sort of live in this little sort of crescent-like shape outside the mucosal cells, but they empty into the duct of the mucosal cells. So all of the cells here use a single central duct. Okay? And so one of the characteristics that's important to note is that only the submandibular and the sublingual have mucus-forming cells, as well as serous-forming cells, whereas the parotid gland has no mucus-forming cells. It has only serous-forming cells. So as we look at this diagram, we know that this cannot be a parotid gland. We see the mucus-forming cells, so we know that it's probably going to be either submandibular or sublingual. Okay, that's number 2 for the digestive system. We have many more to go.